Here, Dr. Jerry, I got the sleep numbers from before. How many chronic patients?
Oh.
Yeah. So we learned about systematic reviews with Dr. Allison Brown from Rutgers.
Oh, yes.
So I got a systematic review. Sheesh. I'm sorry, I'm not a doctor. I got a systematic review here in the National Library of Medicine. They did the study a couple different ways, and they got 72.9% of people with chronic pain and 75.3% of people with chronic pain also experienced severe sleep disturbances. So the correlation that you were referring to is clinically accurate.
Wow.
That's pretty high.
That's very high.
That's super high.
That's higher than I would have thought.
Same, yeah. Wow.
And yet, how many
talks
people are
about
getting
it.
sleep studies?
Exactly.
None. I actually posted something on Twitter. Twitter's the worst because that's where all the evidence-based people will is there research for that?
Yeah.
And it's I pass stuff along. I never hear them talk about. They talk about make sure you have good sleep hygiene, but it's make sure you don't have a disorder.
Yeah.
Especially now, for a multitude of reasons, our faces are not as well developed as they have been in, probably millennia prior.
Yeah.
And so that influences the dynamics of the airway, especially if someone has been breastfed.
Sure.
Or a natural birth.
Yeah.
We don't chew as many hard foods.
Definitely not.
All of that influences how well the face develops.
Exactly,
and that will influence the airway, and that can negatively impact sleep.
That's for sure.
Welcome to the Beyond Physio podcast, where we help you move, excel, and inspire others on your journey to your next level with knowledge and advice from experts and testimonials from our like-minded community.
Welcome to the Beyond Physio podcast. I'm Dr. Jerry Yu, CEO and founder of Next Level Physio. On my show today, we have colleague, Dr. Zac Cupples, who is a master clinician and has a very interesting story and a very interesting method that we have been also incorporating to our practice model. So, Zac, welcome to our show.
Jerry, it's an honor to be here.
It's an honor to have you.
Thank you.
And it's an honor to be treated by you, too. And I don't get a lot of people to work on me, and I don't trust a lot of people. So the fact that you had your hands all over me today was amazing.
That bodes well for building relationships.
Absolutely.
With people, Jerry, not trusting. Yeah, I get it, though. I get it. I have a few people who I would only let work on me as well.
That's awesome.
It's hard to find good clinicians.
It is hard to find good clinicians, especially if they're at your level as well.
Yeah.
So
Flattered.
Talk to me about your journey, because obviously at some point you had studied traditional PT and you have evolved over the years to a different methodology. I want to hear about how that came about and where you were, what made you sort of switch and evolve into this other method that you're doing.
Well, I was very lucky. In physical therapy school, I'm a bit of an obsessive person, so I'm always studying different things and trying to optimize everything. And so when I was in college, I was a mediocre runner, Division III. I wanted to be great, so I studied a lot of training stuff and implemented that, and it escalated my ability to run.
Wow.
And so I applied that principle to physical therapy. So I'm in PT school. I'm reading Men's Health, T Nation, all this training stuff. And I came across Bill Hartman, and I was reading him. I'm like, oh, he writes for these things. He must be good. I'm going to go and learn from him. And so I actually reached out to him in PT school.
Oh.
And he was my CI.
I forgot about this.
Yeah.
Oh my gosh, that's
so
wild.
I was exposed to non-traditional things quite early. Learned the traditional stuff in PT school and was, doing that sort of thing. But then when I interned with Bill, it was like, oh, wow, there's a lot of other stuff beyond that. And we weren't even into a lot of the things that we are now.
Yeah.
And so I was already exposed to a contrarian view quite early, was implementing that. But then I'll never forget this. I went to it was like a conference that they hosted at IFAS where my mentor was, and I saw a lot of my colleagues who had also learned from Bill, and I'm like, wow, they're so much better than me, and I need to get on their level. And so I spent a large amount of time and money early in my career just taking everything I possibly could. I would still learn a lot from Bill. We went through a lot of different methodologies together, and it's just kind of evolved from there. And so that's kind of like led to where I'm at now is I've taken so much Con Ed, and I've spent a lot of time learning from Bill, and I would still say a lot of my model is rooted in some of the foundational stuff that he's taught.
Yeah.
But it's taking all this information, finding a way to condense it into what stuff is most useful based off of my successes and failures, but then also the people who I've worked with and mentored directly.
Right.
And then just finding a way to scale that so more people can implement the same processes. So it's kind of like my tagline is taking advanced concepts and making them ridiculously simple so it's easy to execute.
That's
because
amazing.
that helps the patients
Yeah.
do it, because sometimes the interventions can get complex, but then it helps the clinicians execute it better so the patients can benefit.
That's awesome. From a top level view, could you sort of explain to our audience what it is that you do differently that maybe a traditional PT wouldn't be doing?
It's broad spectrum on a few levels, because it's different on the movement context, but it's also, there's things I look at that are beyond movement. So my intake form looks at everything, not just what your pain is, but how's your relationship with food and your nutrition? How do you sleep? How, do you have a social circle? Like, these are important things that I at least have to call to awareness to people. And even if it's like, oh, you're here for shoulder pain, you need to divorce your spouse. It's like not that, but it's like I try to appreciate that people need to understand that this does influence your pain and function.
For sure.
And then on the movement aspect, what I do differently is, instead of just looking at where you hurt or even the joint above and below, I look at how you move, and then it's a matter of developing a comprehensive strategy that improves motion in all the areas that you're restricted. Because if you're restricted in multiple areas, it's going to change how you move. You're going to put more load into certain areas than not. And then what I do to help people is I help them move where they can't move, and then I implement fitness-based strategies so they can sustain these new movement strategies that they're using over the long haul. And that way it better transfers to what they ultimately want to do, whether it's playing city rec basketball or picking up your grandkid when you're 80.
One of the things I noticed in one of the modules that you taught, and other people who have studied under Bill also focus on this, or they mentioned this quite a bit, that I didn't see a lot in PT school, was just how important the rib cage and the pelvic diaphragms, how they have to really work in an optimized way to be able to have the right capacity for movement in general. Can you go into that a little bit?
Yeah. So all of your arms, your legs, your neck, your back, you have this stuff that links it all together. And it's how well you can move the air within your body and also the abdominal contents and the guts. Those areas have movement capabilities just as much as your joints do, and they behave similarly. And so if I have an inability to move these internal things in multiple directions, it will influence your range of motion. If we go into each of those areas specifically, the rib cage influences your shoulder blade, it influences your arm, and it influences your neck, because it's essentially the base of those things. And so those bones have to move on top of that set of bones. Well, what influences movement of the ribs? The way you breathe does. If we move down to the hips and the knees and things of that nature, the foundational piece there is the pelvis. Well, how does the pelvis move? It moves a small amount, but you have a pelvic floor that also governs what happens at the pelvis and the hips. What alters tension and muscle activity in that area? Well, when you breathe in and you breathe out, your guts move up and down. That changes the tension that is produced in the pelvic floor. And if you talk to any pelvic health physical therapist, they will do breathing-based interventions to improve the dynamics there. And so it's about looking at those fundamental pieces that can influence a broad range of area on your body, and improving your ability to move those areas can have a systemic influence on the way you move.
For sure. Now, let's just say we take a diagnosis like low back pain. What are some things that you might take a look at, or maybe what are some myths that people think about when they think about low back pain that are still in the common vernacular, as you would say?
The influence that structural issues has on low back pain is
Correct.
probably the biggest.
Mhm.
And that's not to say that the structure doesn't influence, but it's less clean than perhaps what an image can say. There's quite a bit of research out there showing that people who do not have back pain can have abnormal findings on
For
imaging,
sure, yeah.
whether that's disc bulges, degeneration, spondy, blah, blah, blah. These are common things I'm sure that you'll see.
Yeah.
The other thing that I think people don't think about is just because an MRI says something, that doesn't mean that it's like definitively read the right way. There was a study that was done, I can't remember when it was, but this was probably within the last 10 years, where they had one MRI and they had, I think it was like 12 different radiologists read it,
Yeah.
and they all came up with, I think there were a total of 35 different diagnoses based
crazy.
off of one
Yeah.
MRI. So the structural, the way you look internally doesn't always correlate with how you move and present externally. And I think that should give people hope when it comes to back pain, because just because you look a certain way, and we know that that certain way is also present in people who don't have pain,
Mhm.
why can't you be in that same category? I think that's probably the most important thing to think about when it comes to back pain. The other thing I would say is it's way more than just movement. There's a lot of factors that increase your risk of back pain that have nothing to do with anatomy and movement and biomechanics. Things such as work satisfaction, job satisfaction,
Huge.
depression are high risk factors for long-standing pain in the lower back. And so it again goes back to like really any type of pain freedom that you want boils down to you becoming a healthier human, and it's addressing all of the areas that are involved in that. And that's movement, that's the way you eat, that's the way you sleep, that's the community that you have,
Yeah.
and the way you manage distress.
I love how you mentioned social as one of those external factors, really an internal factor of why people would still have persisting pain. And it definitely is an issue that I see maybe worsened after the pandemic, where we didn't have those social, support to be able to get past certain things. Have you seen things actually worsen as a result of people not being able to engage with other people in a way that's been meaningful?
That's a good question, because I personally haven't seen anyone from like pre-pandemic and then they lost their social circle because of all the things that had happened, and then how they're doing now. But there is quite a bit of evidence showing that people who do not have a good social circle generally have higher levels of inflammation. And so there's like there's an inverse processes between the two things. So if we think about this from a survival standpoint, like caveman days,
Yeah.
if I'm around people a lot, those people can take care of me. And so I don't have to produce as much inflammation to heal areas quickly, because that's what inflammation's for.
Absolutely.
But people also have diseases. So the immune system actually is boosted when you are around people, because people are gross.
Yeah. They are.
But now on the flip side, if you are socially isolated,
Yeah.
those two systems invert. So your inflammation is higher, because think about it. Like if you sprained your ankle in the woods,
Oh, man.
that has to heal as quickly as possible, otherwise you're going to get eaten by something.
Yeah.
But your immune system dips because you don't have to fight off pathogens that people bring. And that's actually been documented in the research.
That's pretty wild.
So it's a reason to show why being around people is important, because you will be less inflamed, especially if we're talking about chronic loneliness or isolation, and you'll have a stronger immune system.
Yeah.
Now, this was really cool, and I learned this from Dr. Brian Walsh, who's a functional medicine practitioner. That can be circumvented, the social isolation, if you have a strong purpose. Yeah, so purpose is also like another thing that we don't necessarily talk about, but that is actually important for your health. And I think probably the patient who struggles the most is when their purpose is their pain.
I would agree. They're always talking about it like it's their best friend.
Yeah, yeah. And so it's like, is that person truly ever going to get better? Because let's say they achieve pain freedom. Well, then what? It's just hard. And I've ran into people where that's the case, and trying to reframe that belief is really challenging.
Very challenging. I would say, especially with the chronic pain patients, and we've all had them in our lifetime as clinicians, definitely very hard to change that mindset. However, and it's funny because I have found that even when we do get those glimpses of hope, sometimes they're ready to go right back into it. And it's been very fascinating trying to help them work through that.
Mm-hmm.
Has there been anything effective that you tried, either verbally or maybe other professions to get involved in to help those kinds of clients?
I think therapy and counseling is essential on that front.
Yeah.
And that's another thing in my questionnaire that I ask, is I have a bunch of questions related to anxiety, depression, and OCD, actually. Because I also find that's a common thing that is present in people who have persistent pain. Because there's a fixation on whether it's pain or feeling asymmetrical, things of that nature. So I think that that's really important. And then just, encouraging them to do things that are outside of the movement piece. It's like, I've had some patients where, they would devote 6 hours to their rehab exercises before they came to me. And it's like, this is too much.
Yeah.
You need to do other things.
Yeah, for sure. It's funny. I also wanted to see what your opinion was on the effect of hormones on healing. We know that testosterone is a great agent for healing, and we know that over the age of 30, especially for men, also for women, when we stop doing things that help to get that testosterone into our system more flowing, those can also affect how we recover from injury. Do you also see the same thing?
That's not an area that I've looked into that much directly in terms of whether like hormone replacement therapy or things of that nature are useful. It's just one of the things I haven't looked into much.
Yeah.
But I will say this, one thing that is related to hormone health that I think a lot of people gloss over, or that I do look at a lot, is sleep.
Yes.
If people are not sleeping, then that will deplete hormones. And
Absolutely.
And this is one reason why I pushed you to a sleep study, is like, if you potentially have sleep apnea or some other type of sleep disorder that's long-standing, that will create a cascade of many negative health consequences, not just testosterone or estrogen, but also blood sugar, insulin.
Yeah.
All of those are negatively influenced by people who have disordered sleep.
For sure. With our clients, we often talk about having even just a ritual to go to sleep, making sure they're shutting off their phone certain time, avoiding certain bright lights, and dimming things so they can get the sleep they need to. As you and I spoke about, for my case, being an awful snorer, little TMI for you listening, definitely if you have any kind of tendency towards apnea, or if you've been told by your loved ones that you are a bear of a snorer, make sure you get that checked out, because that could be why, if you have any kind of issues right now, physically or therever, that could be why you're actually still in pain. So making sure that's a big part of what you do for yourself outside of the window of physical therapy is going to be helpful for you on your journey towards optimal health.
And there is research showing, and this was very strong, but they had shown that sleep disorder has a causal role in pain. And
there you go.
If you treat sleep apnea, it will improve pain levels. I've seen a study that had illustrated that. But apnea is only one thing. You can also have a thing called upper airway resistance syndrome. An issue that a lot of people have, like especially if they get a sleep study, is they'll only look for apnea, but there's many other things that could possibly be going on. And you don't have to snore to have apnea.
Mm-hmm.
One of my coworkers back at home, she would wake up at like 3 a.m. consistently and couldn't fall asleep. Tiny woman, never snored, ended up having severe sleep apnea.
Wow.
And we actually, she ended up getting a face surgery to cure it.
Oh my gosh.
And now she sleeps great.
Really?
Yeah, it's pretty cool.
That is wild.
But other symptoms, like if you wake up several times during the night to go to the bathroom, if you have a history of bedwetting, if you do not wake up feeling refreshed, if you have nightmares that are consistent, or you do not dream, those are all telltale signs that there's a potential sleep issue. Grinding your teeth at night. That's another one too, that I think a lot of people are like, oh, I just got to wear a
guard
thing. Well, it's like, well, why are you grinding?
Right.
It could be that that's the way that your body helps pull in air efficiently when you are sleeping.
Yeah.
But it's not desirable because when you're clenching, the airway gets restricted.
Yeah. I don't have exact stats, but I can tell you that the number of people who have pain or chronic pain and have issues with sleep, it's probably very high as far as correlation goes.
For sure.
It's crazy.
Here, Dr. Jerry, I got the sleep numbers from before. How many chronic patients?
Oh.
Yeah. So we learned about systematic reviews with Dr. Alison Brown from Rutgers.
Oh, yes.
So I got a systematic review. Sheesh. I'm sorry, I'm not a doctor. I got a systematic review here in the National Library of Medicine. They did the study a couple different ways, and they got 72.9% of people with chronic pain and 75.3% of people with chronic pain also experienced severe sleep disturbances. So the correlation that you were referring to is clinically accurate.
Wow.
That's pretty high.
That's very high.
That's super high.
That's higher than I would have thought.
Same, yeah. Wow.
And yet, how
one
many
talks
people are
about
getting
it.
sleep studies?
Exactly.
None. I actually posted something on Twitter. Twitter's the worst because that's where all the evidence-based people will is there research for that?
Yeah.
And it's I pass stuff along. I never hear them talk about. They talk about make sure you have good sleep hygiene, but it's make sure you don't have a disorder.
Yeah.
Especially now, just for a multitude of reasons, our faces are not as well developed as they have been in probably millennia prior.
Yeah.
And so that influences the dynamics of the airway, especially if someone hasn't been breastfed.
Sure.
Or a natural birth.
Yeah.
We don't chew as many hard foods.
Definitely not.
All of that influences how well the face develops.
Exactly,
and that will influence the airway, and that can negatively impact sleep.
That's for sure. It's crazy.
And tongue ties are actually quite prevalent too.
Is that right?
Mm-hmm. So a third of people are born with a tongue tie. That number might not be accurate, but it's pretty high.
Wow.
And so if that's you,
Yeah.
then and you're a baby, you can't latch as well when you're breastfeeding. And so the people who are colicky and stuff like that actually might have a tongue tie. But then it's harder if you can't get your tongue to go for your mouth. Then you're not nasal breathing as well. Well, guess what? When you mouth breathe for an extended period of time, instead of the face growing more forward, it grows longer. And then the head goes forward. Right. And then that influences the airway, and then you have sleep problems.
I learned more about sleep in this episode than any other time.
I like talking about it.
It's amazing.
It's fun. Yeah.
Maybe we should open up a sleep center.
There you go.
Cha-ching. There we go. I want to get into breathing a little bit. On previous episodes, we had Sean Pritchard and we had Sean Astorga. Talk about your guy.
Man.
So we also had them on the show talking about different aspects of breathing and why they're beneficial. Tell me about how you were coaching me through, making sure that you breathe in silently through your nose and soft exhale, long exhale, why that's beneficial for the system in general.
So there's different strategies that you can use depending on what your goal is. So the reason why I coached you specifically in that way, and I do it that way with mostly exercises where I'm trying to gain motion, is on the inhale, I need it silent and easy because I want to try to minimize muscle tension. If you have less muscle tension, you can, in theory, create more space within your body to move because you're not using big muscles to pull air in. So less tension, more mobility. With the exhale, I needed it to be longer than just a typical nasal exhale, which is what I encourage people to do when they're not talking to someone or just chilling, is because I am trying to create a little bit more muscle activity on that phase of breathing so then I can drive specific motion into an area. So think of it this way, like if I wanted to work on my hip extension. So, people will typically do like a hip flexor stretch.
Right.
So you don't know what hip extension is, that's your leg going behind you. Well, it's often thought that, if I can contract the glutes, that will help me drive more of that motion.
Sure.
And so I have to create that contraction to really get in that range. It's the same process with breathing. So if I exhale and it's a little bit more forceful than a typical exhale, I might be able to create a bigger motion change than if I just worked with something that's a little bit more low key. But I only coach breathing that way when it comes to improving movement. If it's just you and I are chilling, watching TV, or I'm going for an easy walk, or I'm doing cardio, that's all mouth closed, quiet in and out through the nose. And the reason why I'm doing that is because I want to try to keep the blood vessels as dilated as possible. Nasal breathing helps with that.
Nitric oxide, I've heard too.
Nitric oxide.
Yep.
And it's just a lower stress strategy. If I'm lifting something really heavy, I might take a much larger inhale, and then I might hold my breath to move that weight because I need to generate more pressure to lift something heavy. If I'm doing something that's really stressful, like I'm doing an all-out sprint or something that's much longer, I might need to breathe fast, and I might need to breathe through my mouth because I need to blow off carbon dioxide I can prevent hydrogen ion buildups, which is what people typically think of as like the lactic acid effect.
Yeah.
So there's a lot of different ways you can use breathing depending on what your goal is.
That's awesome. I know that there was as long as I can remember, a very big push for diaphragmatic breathing, but that just covers one area or one technique to breathe forcibly. Do you find that that's also maybe not the best way to breathe depending on how you are as a person?
Are you defining like diaphragmatic breathing as belly breathing?
Correct.
Okay, got it. Because we'll always breathe with our diaphragm unless you
true.
had a spinal cord injury.
Absolutely.
Belly breathing is not useful in my opinion because when you breathe in, your lungs have to fill in all directions.
Yeah.
And so the rib cage should actually move. If I belly breathe only and I don't allow that to happen, well, then I'm producing more tension in my upper body. And then from a pressure standpoint, when I do breathe in and breathe out, you kind of want a 1-to-1 ratio between the thorax or the torso and the abdomen. If I limit motion in the rib cage, then I've altered that ratio of pressure. So then the guts move downward more, and that's not desirable from a breathing standpoint. I get why people do it. It's because they want to minimize the neck and chest muscles kicking in. But there's a middle. You're essentially taking one problem to solve another problem. The better bet is to make sure that the inhalation is easy enough that the rib cage can normally expand, and the ab wall can expand simultaneously and in a similar ratio. That is a better choice because then you're getting the benefits of minimizing muscle tension in the upper body, but it's probably even better because you're actually allowing the rib cage to move and you're better pressurizing both areas.
That's cool. Thanks for explaining that. Now, with regards to certain kinds of cases out there, how might something you do would be different than maybe a traditional PT would do? And I can think of many things. Let's just say somebody with a rotator cuff issue. What are you looking at? I know we're taking a whole body approach to this. Are there some specific things that you're looking at when somebody comes in with a right shoulder issue, for example, rotator cuff issue, that somebody who is purely OCS, APTA trained PT will look at differently and do?
I'm a retired OCS
Yes,
now, by the way. Actually,
that's right.
I didn't
saw that.
renew.
Ah.
Anyway,
What is OCS?
OCS is orthopedic clinical specialist. Yeah.
So you're has-been.
I am. Yeah. I actually did like the residency and all that stuff.
You did? Where'd you go for the residency?
St. Ambrose University, which is where I went to PT school.
Oh,
so
okay,
yeah, I
nice.
just did the residency after that. Yeah.
Well, it's funny because I was talking to Ken because he had asked me if you should do an orthopedic residency. This is a couple of years ago, and I said, I don't think you're going to need to do that, man. What are your thoughts on that?
I think you should learn from someone. Learn from the person who you want to best emulate.
There we go.
And so when I did my residency, I think I was like thinking, oh, I'm learning a lot in school. I want to keep that going. And then I met Bill, and it's like, oh, I actually want to do it this way. But then I kept the residency. And a part of one of my character flaws is I want to see things through no matter what because I'm not a quitter. But sometimes sometimes the best thing to do is quit. And so unfortunately, like when I was in my residency, and because I had a much larger ego then than I do now, I just butt heads a bunch, and it just wasn't the best thing. And it's not. I'm not blaming them.
Yeah.
I'm not blaming. It was just not a good fit.
I see.
And so if you can get that through a residency, then cool. But if you want to do things like how I do it, then it's not the best course of action.
Before we dive into that last question I asked, tell me more about the interaction as far as, would you sort of present another way of looking at something and then the OCS guys would be like, oh, no, what are you talking about?
Not all.
Okay.
Some, yes. Some were open-minded to that. But yeah, it was just kind of hit or miss. And, it's probably, I think, a lot of it was probably my delivery at the time, because my approach has evolved, but it's still kind of been non-traditional. And I found that as I've done this for longer periods of time, people have been more receptive to me bringing something in that's different.
I see.
And yeah, so I think a lot of it is just the way I approached myself, as opposed to like, it's got to be this way, or it's like, hey, what do you think about this?
Right. Because I feel like there's, even as an OCS or as an orthopedic specialist, there is room to really sort of change your viewpoint, or at least look at things differently, which is I think what you provide through your material, through your YouTube channel content. And I feel like if you kind of study that, it's like, oh, it's not like he's trying to be polarizing in what he's saying. It's just that he's approaching it from a different way to solve the same problem that you might have in a very different approach.
Yeah, yeah. Well, and I think some of the OCS-based stuff, or like the classically trained things, are useful, especially from like a differential diagnosis standpoint, to make sure like you're in the right place. But where I think I differ in that sense is, even the person who has a right shoulder, if it's right shoulder, if it's left knee, if it's your ankle, if it's neck, there's a similar assessment. Like, I'm looking at similar things from a movement perspective, and I might look at other things, depending on, like, I don't always assess the ankle on people, but then I ended up doing it with you,
yes,
right? And
absolutely.
You didn't have an ankle problem.
Yeah.
But I look at the person in total, and when I see a cluster of tests, it gives me an idea of what that person's movement strategy is in general. And then it's a matter of giving them a different movement strategy, so that way they're not loading or overloading the area that is hurting. And that's basically what I do. And so conceivably, you could look at it two ways. I can have two people who have right shoulder pain who I use completely different interventions for, because they're built differently and they move differently. Conversely, you could see me treat someone who has right shoulder pain and then another person who has left knee pain, and I might actually give them the same exercise because they are built similarly for those issues. And so it's a matter of improving their ability to move as a whole, and then building fitness qualities atop of that, so they don't run into that strategy again.
That's awesome. I noticed in some of your videos, actually, on your YouTube channel, that, for example, there might be a way that people do a split squat, but you have your heel elevated. What does that actually allow people to do differently that they can't achieve on their own with their foot flat?
It allows them to access motions that they might not be able to readily access, or it's a way of shortening the range of motion. It depends on the person. So like, let's say someone can't squat below parallel. Well, you wouldn't program full squats under heavy load if they can't squat below parallel. There's exceptions to that, or this is probably even better. Let's say someone can only raise their arm just above their shoulder.
Sure.
You're not going to give them overhead presses.
No, definitely not.
How are they going to get there?
Yeah.
Well, apply that same principle to something like a split squat. If someone is lacking certain rotations in the hip, or they can't dorsiflex their ankle past zero, which, if you don't know what dorsiflexion is, that's like lifting the foot off the gas, and then you ask them to do a motion where it requires that, well, how are they going to get there?
Exactly.
You need to meet people where they're at. And so using a prop like a wedge, or elevating a foot, or having them hold a weight in a certain way can help facilitate that, because their body has to react differently to the constraint. And so that's all that these things are, is it's just constraining the exercise in ways so I can achieve the goal that I want. If we go back to you when I worked with you earlier, I elevated, like, there was a squat that I gave you where I elevated your right foot and I had you hold a weight on the right side. Well, why is that? I constrained the exercise so I could get a certain motion that you needed, so you have more motion available, so you're not overloading the areas that you tend to overload. That's it. And that principle, I mean, that transcends beyond movement. It's like when when we're talking about getting someone to come see us as physical therapists, we
Yeah.
have to meet them where they're at so they can get to where they want to be.
That's exactly it. I love that. Cool. Zach, can we talk more? Let's dive into the ribcage again. We talk about how the angle, the ISA or the infrasternal angle, for anyone listening out there, is basically the bottom of the ribcage in simple terms. Some people have a wide angle, other people have a narrow. How does that change what you might emphasize in a given session?
Sure. So all that it is, neither of the angles are good or bad. It's just like the way I think of it is it's like two different cars. Like which car is better, a Tesla Model 3 or a Toyota Tundra? Well, it depends on your goal. I'm biased to Tesla, of course. That's why I rented one to here. So all it does is it tells you like what the person's structural constraints may or may not be. So if I'm a narrow person, there might be certain things that that person, based on their structure, could be better at versus a wider framed person. For example, like there's a reason why gymnasts all look a certain way, and especially female gymnasts are usually very tiny and they're very narrow framed, versus an NFL lineman. Like there's a pretty stereotypical build of each of those extremes, and it's because their structure is built to do that thing well. And based on those structures, there will be certain movements that that person may have more easy access to, and they might be limited in certain areas. And same thing with the opposing strategy. And so what the rib cage angle tells us is what those constraints are, and then we can base our movement interventions off of that. And that doesn't mean that, you're a narrow person, you can never play in the NFL.
Right.
It's just like your body might have to find a different way of performing that compared to someone who's got a wider frame.
That's great. Thank you for that.
Of course.
Finally, as far as the types of clients that you see, what does that range look like? Do you have sort of an ideal client that you look for and to work with, or who will get the best results from you?
Someone who will do everything I tell them to is the best.
Exactly.
Compliant
person.
Yeah. It really depends because there's because I work remotely and I also work in person. A lot of my remote clients are either movement and fitness professionals or clinicians. I have a ton of those. Or I have people who have literally tried everything and I'm the last resort.
Yeah.
And I also get that in person, but I also get athletes and I get other high-performing individuals, whether it's CEOs of companies or things of that.
Yeah.
And so if I don't really care who I work with, like you could be, I could work with an athlete 1 hour, and then the next hour I might work with an 80-year-old, doctor who's having a shoulder issue, which is a pretty typical day. I need someone who is open-minded, who's willing to put into the work and be self-sufficient, and recognizes that reaching their goals is likely more than just one thing that needs to be addressed. And if I have someone who's like that and they put in the work, they'll do very well. And that's who I like working with because it allows me to help guide them to their goals via a multitude of ways.
That's great. So a lot of these people obviously find you on your YouTube content or your Instagram channel, which is amazing. So you don't actually have to reach out to people per se. They actually come find you. Yeah.
Well, my reaching out is I just continue to try to help them as many ways as possible for free. And then eventually people want to work with me because, the thing is like when it comes to looking up watching YouTube videos versus working with someone directly is there's a time constraint or component. Like you could learn everything you need to learn by watching my YouTube, reading my blog, all that. But that takes time. You could also just work with me, and then in an hour we can pick moves that are like the best ones for you.
For sure.
And then I'll make sure you're doing them well.
Yeah.
So that way you get the most out of them.
Definitely. I find that my sessions with you have been just that way where I don't have time to, I like your content, but I don't have time to always watch everything and piece everything together. But just being efficient with my time and being able to get it from the source for me is really important too, like yourself. So, and I've been finding very helpful. Today, our session went amazing. I just feel really, really good. So thank you, Zach.
Well, you worked really hard today. So
I did.
I'm
yes.
just your guide, man. You took care of yourself.
Thank you. Also, what I noticed that you don't do a lot of hands-on, which is kind of cool. You do a lot of cueing, and some hands-on we did, but it wasn't really, which I can see why you can do your type of treatment virtually as well.
Yeah, we don't have the Zac Cupples USB hand attachments to do manual therapy.
Not yet, anyway.
Yeah. I do both. I don't really see a difference between hands-on versus exercise. It's just manual therapy is essentially the most regressed form of exercise because you're still active in the process. If you're breathing, then you're still moving. And so all I'm doing is constraining things a certain way. Typically, I'll do hands-on work to basically give me an idea of what I think could be effective for someone.
Yeah.
So like in your case, I did something to your foot to see what would change.
Yeah.
And it's like, yeah, that's the manual technique to do that. But then it's also like, oh, okay, so if I can get you to do this actively, then that should produce a similar benefit.
Right.
That's it.
Yeah.
So, and that was like, another thing we did. I did that squish where I rotated you.
Yeah.
And it's like, that kind of helped. But then when I did the one rotation up top, that really helped your right shoulder.
Quite a bit.
So then that gives me like, oh, okay, so I know I need to take Jerry here at some point.
Yeah. And it's important, actually, you reminded me, like, it's, although we like to help people, we also need to be helped too. And to have that trust from people like yourself, Zac, very important for me too. So thank you. I want to ask you, as we get to the end of this show, what is one of your guiltiest pleasures when it comes to food?
Crumble cookie is a big one for me. Yeah.
Little
There was a
ice cream
period of time where I was going every week and and trying several.
Wow.
But now, because I've had almost all the flavors, like I haven't gone the last 2 weeks because I'm like, guys, you're dropping the ball in terms of what is good. So I do like crumble cookie, but I'm a big foodie. I go out to eat, especially like there will be periods of time like last week I went out to eat probably 4 times.
Wow. Yeah.
Because either I'm going with my girlfriend and we're trying a place new because I live in Vegas. I have this whole list of restaurants awesome. I want to try.
Yeah.
Or like, oh, my buddy's moving out of town. Well, let's go here. And then it's like, so I go out to eat a lot and I like all types of food. I like weird things.
So do I. That's funny.
Yeah.
Like I just try something, even if it's weird looking, just for the experience of it.
What's the weirdest thing you've had recently?
Oh, man. Oh, you know what? When I was in Korea, we had raw squid while it was actually still alive.
Really?
That was I got very nauseated afterwards, to be quite honest. But I mean, to feel it in your mouth, like moving around, it was kind of a little surreal. I don't think I would do that one again.
Wow. That's very this is Mother Nature right here.
Absolutely. How about you?
So I went to, there's a place I go called the X Pot in Vegas. You been to X Pot? That's good, man. Yeah, it's a hot pot.
Oh, yeah.
But they have all types of unique things. Like I ate duck blood.
Duck blood?
Pretty good.
Wow.
Yeah.
Savage.
Yeah. And I've had goose intestines while I was there. Ooh. Those are like okay.
Yeah.
But the duck blood's really good. And there was like duck gizzard.
Okay.
Ox aorta.
Ox aorta?
Yeah.
Is it very chewy, I'm guessing?
It was, yeah. And then like, I think it wasn't duck. It might have been duck feet or duck flipper.
Oh my God.
Also very chewy.
Wow.
Yeah. But that stuff's like really good. So I like eating weird things like that.
That's awesome.
Yeah.
So, Zac, if people want to work with you, what's the best way for them to get in touch with you?
The best way to get in touch with me is to go to my website, zaccupples.com. That's ZACCUPPLES.com. And so in terms of like direct services, I offer movement consultations where basically I find out where you can't move and I get you to move in those areas that are restricted. And I also offer online training. And I'm actually in both of those fields, I'm hoping to have not just myself, but other people because I do charge a higher price. And so I want to make sure I can serve more people. So we also have some I don't want to say they're middle tier because they're both very good, but like my guy, Chris Collette, he does fitness training for a lot of clients as well. And so we also offer fitness programs as well. So like I think improving movement is one piece, but if you can demonstrate good movement at higher intensities, that's really what's going to sustain you over the long haul. So that's why I think fitness training is important.
Huge.
And it's not like, oh, you do these exercises and then we, are going to do all these things that aren't related to that whatsoever. But what I think we do a good job with as a company is meeting people where they're at. And so it's a matter of doing things to increase the amount of movement that's available, and then working within certain exercises that have few trade-offs for that person, so we can pursue fitness qualities that are necessary for them to reach their goals.
Right.
And so those are the ways that I work with people. And then I mentor a lot of clinicians and other people in the industry and teach seminars, which is what we're going to be doing tomorrow.
Yes, I'm very excited for that.
Yeah.
Zach, thank you so much for being on our show. Really had a pleasure having you on.
Thank you for having me, Jerry.
Cool.
All right, real quick, we'll do some silly questions just to get an idea. I mean, you seem, you're an electric personality. But we always like
caffeine.
to throw.
Is that one in the bottle right there?
No, but I have had there's a Starbucks right by my hotel.
Oh, yeah.
So I had a venti cold brew, and then on the way here, I had a grande, the brown sugar oat milk espresso.
Oh, yeah.
Shaking
Good.
almost.
I don't like Starbucks, but like it's
Yeah.
their cold
That's
brew's
true.
pretty good,
The
and
colds
it's
are good,
reliable.
If you had to pick one for the rest of your life, would you rather be blind or live inside of an Olive Garden restaurant?
I think I would go with living inside of an Olive Garden restaurant.
You
'cause
picked well.
You get unlimited breadsticks.
We talked about that. That was the biggest thing.
And when you're there, your family.
Exactly. There. Yep.
So
He chose well. He chose very
When
well.
you're there, your family.
yeah.
What was the would you rather fight Mike Tyson or sound like him for the rest of your life?
I think I would rather sound like him because he's done. Well, Mike Tyson could kill me.
Yeah.
True.
So,
but
like-
he has some training
That's what I'm
first.
saying.
I think it may lessen the blow a little bit. Maybe a little concussed.
Okay,
but-
maybe I last 5 seconds.
Exactly.
Instead of
Yeah.
like
You want
0
to sound like
seconds.
the rest of your life, though.
Can you train the membrane between your brain and your skull? That's
Think about how iconic his voice is.
it's true.
It's like he
Marketing.
has done so well in spite of his voice, and
True.
like
And because of
because of his voice, yeah. So like little ticks like that are, I think, an asset more so than a liability. Look at Arnold Schwarzenegger. Everyone had said in his beginning acting days, you need to do things to get rid of your accent. But he took what was a perceived weakness and made it a strength. And that's why he is, one of many reasons why he is such an iconic human.
For sure.
So I think I would take that. Because you know what? A concussion from Mike Tyson or death is not going to help me move forward. So I would definitely take his voice.
we've asked that question a couple times.
Because most people say they would fight rather than have the voice.
Yeah.
Yes.
And not only that, the perspective shift on marketing and using it as a marketing lift or a direct marketing lift is brilliant and hasn't been brought up until today.
This is the first time. Yeah.
And I'm a little embarrassed to admit that. And then we'll do a quick last one. Alien invasion. You have to pick one human to represent the human race. Who is it?
The first person that comes to mind is Elon Musk.
Oh,
That's not.
hey.
I mean,
And my thought is
Not bad.
because he is so esoteric enough,
Yeah,
and
exactly.
that they might actually think he's one of them,
exactly.
and
Exactly.
therefore would not cause us our
Oh, this is
untimely
already-
destruction.
They've already been invaded. No,
Oh
we'll keep
my
moving.
God.
Yeah. Oh, Eli, yeah.
Okay, we go. Okay.
Yeah.
We were looking for you.
Yeah. Which didn't they just say? There's that whole thing going on right now. Like they admitted that there's UFOs and they have
Yep.
non-human biologics on these things.
Correct. Yep.
But I also, but evidently, like, I don't know, like, there's still some controversy about these specific people coming out with that information.
I
Very
believe it.
interesting.
Yeah.
I believe it. It feels like a Wizard of Oz situation. A
Yeah.
lot of smoke and mirrors and.
But the guy
Just wanna-
testified under oath with Congress. Yeah.
This is interesting.
Yeah.
Cool.
We'll see. Awesome.
Awesome. Thank you.
Thank you.
That's a wrap.
That was fun.
Dr. Ken, do you have any questions? As it. No, yours is great. Yours is great.
Were you the person who did the earlier podcast?
Yeah.
Because I heard you were doing
Okay,
another
good.
podcast. Wow, man, you were grinding.
I was grinding today. Yeah.
Sure, I got one. What's your favorite muscle and why?
My favorite muscle is probably the diaphragm, because if you don't have that, none of the others matter.
It's no follow up for that one. I'm like, bicep.
Well, hey, I do kiss my bicep a lot in my videos, but if I don't have a diaphragm, I can't breathe, then the bicep's relevant. Yeah.
Or I was gonna say the spinalis dorsi of the cow, the cap of the ribeye. That's my favorite muscle.
Ooh, good call. Good
Right?
call.
Switch it up.
Yeah. Anyone ever said pyramidalis? There's a good one.
I don't.
That is skirt steak.
Oh, skirt steak.
Man,
Good
we might have to
call.
have some diaphragm
Love
today.
skirt steak.
Dr. Ken from the rafters.
Oh.
Good call. What was that last muscle you said after I said spinalis dorsi?
Pyramidalis.
What is that?
It's this really tiny muscle in your pelvis that like tenses some fascia. It's the so I think there's 34. There's either 34 or 36 muscles that attach to the pelvis in some way. Most people skip the pyramidalis. Yeah, but really you got to lead with that. It's just like when they talk about the 17 muscles that attach to the scapula.
Okay.
Always lead with the omohyoid.
That's right.
That's the one people miss. So you got to know that one.
Yeah, you took your mic off too fast.
I'm a hyoid.
All right, thank you guys.
Thank you.
Thanks so much for tuning into today's episode. It really does mean a lot to us. And don't forget to like, share, subscribe, or comment if you got at least one or two helpful insights or takeaways to help you get to your next level.